How do you ensure accurate medication administration in a fast-paced ED environment?
In a fast-paced emergency department (ED) environment, ensuring accurate medication administration is critical to patient safety. My approach begins with adhering strictly to the 5 rights of medication administration: the right patient, the right drug, the right dose, the right route, and the right time. Before administering any medication, I always verify the patient's identity using at least 2 identifiers, such as their name and date of birth, and cross-check this with their medical records. To manage the rapid workflow, I stay organized by prioritizing tasks and utilizing available technology, such as electronic medical records, EMR, and barcoding systems, which help reduce the risk of errors. I make it a point to double-check any calculations for high-risk medications, particularly those that require weight-based dosing or have a narrow therapeutic range. Communication is also key in a high-pressure environment like the ED. I ensure clear and concise communication with my colleagues, particularly when a medication is being administered as part of a team effort. This includes confirming verbal orders and repeating back any instructions to avoid miscommunication. If I encounter any uncertainty, I do not hesitate to clarify with the prescribing physician or consult the pharmacy. Additionally, I remain vigilant for potential drug interactions or contraindications by reviewing the patient's medication history, and I stay up to date with the latest protocols and guidelines to ensure safe practice. By combining these practices with a calm and focused approach, even in the most hectic situations, I am able to maintain accuracy in medication administration, which is essential for delivering high-quality care in the ED.
Describe your experience in managing patients with acute myocardial infarction, AMI. What are the key interventions and protocols you follow?
In managing patients with acute myocardial infarction, AMI, my experience has taught me the importance of rapid assessment, prompt intervention, and adherence to established protocols to improve patient outcomes. Upon receiving a patient suspected of AMI, I immediately initiate the assessment process, prioritizing vital signs, oxygen saturation, and obtaining a 12-lead ECG within 10 minutes of the patient's arrival. This initial assessment is crucial for confirming the diagnosis and guiding subsequent interventions. The key interventions I follow are based on the latest international guidelines, including the administration of oxygen if the patient is hypoxic, sublingual nitroglycerin, and aspirin to reduce platelet aggregation. I ensure that intravenous access is quickly established for the administration of medications, such as anticoagulants and analgesics, as needed. Time is a critical factor in AMI management, so I work closely with the interdisciplinary team to ensure that reperfusion therapy, whether thrombolysis or percutaneous coronary intervention, PCI, is initiated as quickly as possible. I am vigilant in monitoring the patient for any signs of complications, such as arrhythmias or heart failure, and I am prepared to respond swiftly by following advanced cardiac life support, ACLS, protocols if necessary. Throughout the process, I maintain clear and ongoing communication with the patient and their family, providing them with information about the condition, the treatments being administered, and what to expect. This helps to reduce anxiety and ensure that the patient's consent and understanding are prioritized. Post-intervention, I continue to monitor the patient closely, watching for any signs of recurrent ischemia, and ensuring that all follow-up care, such as secondary prevention measures and lifestyle counseling, is in place before discharge. My approach is guided by a commitment to evidence-based practice, continuous education, and a strong emphasis on patient-centered care, which together contribute to the effective management of patients with AMI.
How do you assess and manage patients with severe allergic reactions, anaphylaxis?
When assessing and managing patients with severe allergic reactions, specifically anaphylaxis, my approach is structured, swift, and based on international standards to ensure the best possible outcomes. Upon identifying the signs and symptoms of anaphylaxis, such as difficulty breathing, swelling, rash, and hypotension, I immediately prioritize securing the airway, breathing, and circulation, ABCs. The first step in management is the prompt administration of intramuscular epinephrine, as it is the first-line treatment for anaphylaxis. I administer the appropriate dose into the mid-outer thigh, repeating it every 5 to 15 minutes if symptoms persist or worsen. In parallel, I ensure that oxygen therapy is provided to support the patient's breathing, and I establish intravenous access to administer fluids and other necessary medications, such as antihistamines and corticosteroids, to reduce inflammation and prevent the recurrence of symptoms. I continuously monitor the patient's vital signs, including heart rate, blood pressure, respiratory rate, and oxygen saturation, to assess the effectiveness of the treatment and to detect any signs of deterioration. If the patient shows signs of airway obstruction or severe respiratory distress, I am prepared to escalate care, which may include intubation and mechanical ventilation if required. Clear communication with the interdisciplinary team is crucial during these emergencies. I ensure that all members are aware of the patient's condition and that an action plan is in place, including rapid access to advanced life support if necessary. Additionally, I make sure to inform the patient and their family about what is happening, explaining the treatment being provided and addressing any concerns they may have. Once the acute phase is managed, I focus on preventing future episodes by identifying the trigger, providing education on the use of epinephrine autoinjectors, and ensuring that the patient has a comprehensive follow-up plan, which may include referral to an allergist for further evaluation and management. My goal is to not only treat the immediate reaction but also empower the patient to manage their condition effectively in the future.
What is your approach to managing patients with traumatic brain injuries, TBIs?
When managing patients with traumatic brain injuries, TBIs, my approach is systematic, focused on stabilizing the patient, preventing secondary injuries, and ensuring comprehensive care. Upon the patient's arrival, I prioritize a thorough initial assessment, beginning with the ABCs, airway, breathing, and circulation, to ensure that the patient is stabilized. Given the critical nature of TBIs, I pay particular attention to maintaining a patent airway and adequate oxygenation to prevent hypoxia, which can exacerbate brain injury. I conduct a detailed neurological assessment using the Glasgow Coma Scale, GCS, to evaluate the patient's level of consciousness, as well as other neurological signs such as pupil reactivity, motor responses, and any signs of intracranial pressure, ICP. Any deterioration in these parameters is treated as a medical emergency, requiring immediate intervention. To manage patients with TBIs, I follow protocols that include imaging, usually a CT scan, to assess the extent of the injury and guide further treatment. If there are signs of increased ICP, such as a declining GCS score, I implement measures to reduce it, which may include elevating the head of the bed to 30 degrees, ensuring proper sedation, and administering osmotic diuretics like mannitol or hypertonic saline as per the medical team's orders. Preventing secondary brain injury is a key focus, so I carefully monitor and maintain stable hemodynamics, ensuring adequate blood pressure and oxygenation to the brain. This includes continuous monitoring of vital signs and adjusting treatment as needed to keep cerebral perfusion pressure within the optimal range. Pain management, seizure prophylaxis, and maintaining normothermia are other important aspects of TBI management. I work closely with the interdisciplinary team to develop and implement a care plan that addresses these factors, ensuring that all aspects of the patient's condition are managed proactively. Family involvement is also crucial in TBI cases. I ensure that the patient's family is kept informed about the patient's condition, the treatment plan, and potential outcomes, offering support and education throughout the process. In the long term, I assist in coordinating rehabilitation services to help the patient regain as much function as possible and work with the care team to plan for a safe discharge or transfer to a specialized facility if needed. My approach is rooted in evidence-based practice, a deep understanding of the complexities of TBIs, and a commitment to providing compassionate, holistic care.
How do you handle patients with acute respiratory distress syndrome, ARDS?
Handling patients with acute respiratory distress syndrome, ARDS, requires a meticulous and multidisciplinary approach to stabilize the patient, optimize oxygenation, and minimize further lung injury. When managing a patient with ARDS, my first priority is to ensure that they are receiving adequate oxygenation. I closely monitor oxygen saturation and blood gas levels to guide interventions, starting with administering supplemental oxygen. In severe cases, where non-invasive methods are insufficient, I assist with intubation and the initiation of mechanical ventilation. Mechanical ventilation strategies for ARDS are critical and are guided by evidence-based protocols. I follow the principles of lung protective ventilation, which includes using low tidal volumes, 4 to 6 ml/kg of predicted body weight, and maintaining plateau pressures below 30 cm H2O to prevent ventilator-induced lung injury. I also collaborate with the respiratory therapist and physician to adjust the positive end expiratory pressure, PEEP, to keep alveoli open and improve oxygenation while avoiding overdistension. In certain cases, I may be involved in implementing prone positioning, which has been shown to improve oxygenation in patients with severe ARDS by redistributing ventilation and perfusion. This intervention requires careful coordination and monitoring, and I ensure that all safety protocols are followed to protect the patient from complications. Continuous monitoring is essential in ARDS management, so I regularly assess the patient's respiratory status, ventilator settings, and hemodynamics, and I am vigilant for any signs of worsening or complications such as barotrauma or pneumothorax. I also monitor the patient's fluid balance carefully, as both fluid overload and dehydration can exacerbate ARDS. Another crucial aspect of managing ARDS patients is minimizing sedation to facilitate spontaneous breathing and reduce the duration of mechanical ventilation, as well as preventing complications like ventilator-associated pneumonia. I work with the care team to develop a sedation and weaning plan that is individualized to the patient's needs. Family communication and support are also key in ARDS management. I make sure that the patient's family is fully informed about the condition, the treatment plan, and the prognosis, providing them with the support they need during this challenging time. Finally, my approach is guided by the latest research and best practices in critical care, and I stay informed about emerging treatments and therapies that may benefit my patients. By combining technical expertise with compassionate care, I aim to improve outcomes for patients with ARDS while supporting their overall well-being.
What is your experience with pediatric trauma? How do you assess and manage pediatric patients in the ED?
My experience with pediatric trauma involves a careful and child-centered approach that prioritizes both the physical and emotional needs of young patients. In the emergency department, ED, managing pediatric trauma requires a nuanced understanding of developmental stages, anatomy, and appropriate communication strategies to ensure the best outcomes. When assessing a pediatric trauma patient, my initial focus is on the ABCs, airway, breathing, and circulation, just as I would with any trauma patient. However, with children, I am particularly attentive to the potential for rapid deterioration due to their smaller size and different physiological responses compared to adults. I use age-appropriate equipment and techniques to conduct a thorough assessment while ensuring that the child is comfortable and as calm as possible. For example, I assess the airway and breathing with gentle techniques and utilize pediatric-sized equipment, such as smaller endotracheal tubes and masks. Monitoring vital signs, including heart rate and blood pressure, is essential, and I am mindful of the normal ranges for different age groups, as these can vary significantly from those of adults. In cases of trauma, I perform a rapid but detailed evaluation, including a head-to-toe examination to identify any injuries or signs of internal bleeding. I rely on both physical examination findings and imaging studies, such as X-rays or CT scans, to guide further management. It's crucial to communicate effectively with both the child and their family, providing reassurance and explanations in a way that is age-appropriate and reduces anxiety. Pain management is another critical aspect of pediatric trauma care. I use pain assessment tools designed for children, such as the Flax scale or Wong-Baker-Faces pain rating scale, and administer appropriate analgesia while considering the child's age and weight. When it comes to treatment, I follow pediatric trauma protocols, which include stabilizing any fractures or dislocations, addressing any internal injuries, and providing supportive care. I work closely with pediatric surgeons and specialists to ensure that any necessary interventions are timely and appropriate. I also emphasize family-centered care, involving the family in the treatment plan and keeping them informed about their child's condition and prognosis. Providing emotional support to both the child and their family is crucial, as trauma can be a frightening experience for young patients. Overall, my approach to managing pediatric trauma is characterized by a combination of clinical expertise, compassionate care, and effective communication, ensuring that both the medical and emotional needs of the child are met in the ED.
What are the signs and symptoms of a pulmonary embolism, and how would you respond to a patient presenting with these symptoms?
When a patient presents with a suspected pulmonary embolism, PE, it is crucial to recognize the signs and symptoms promptly to initiate appropriate treatment. The signs and symptoms of a pulmonary embolism can vary depending on the size of the embolus and the patient's overall health, but common manifestations include sudden onset of shortness of breath, chest pain, which may be sharp or pleuritic, and a feeling of impending doom. Other symptoms can include tachycardia, tachypnea, hemoptysis, and occasionally, signs of deep vein thrombosis, DVT, such as swelling or redness in the legs. In response to a patient presenting with these symptoms, my approach is systematic and focused on rapid assessment and intervention. Initially, I perform a thorough evaluation, including a detailed history and physical examination. I assess vital signs, including respiratory rate, heart rate, blood pressure, and oxygen saturation. I also inquire about risk factors for PE, such as recent surgery, prolonged immobilization, or a history of clotting disorders. Diagnostic testing is essential in confirming a PE diagnosis. I order appropriate imaging studies, such as a computed tomography pulmonary angiogram, CTPA, or a ventilation perfusion, V/Q, scan, based on the patient's stability and available resources. While waiting for these tests, I may also order a D-dimer test, although it is not definitive and is more useful in ruling out PE in low-risk patients. Management of a confirmed pulmonary embolism involves several critical steps. If the patient is hemodynamically unstable or in severe distress, I initiate supportive measures such as supplemental oxygen and intravenous fluids to stabilize the patient. Anticoagulation therapy is the cornerstone of treatment for most patients with PE, and I administer medications such as heparin or low molecular weight heparin, followed by oral anticoagulants if indicated. In cases where the patient is at high risk of mortality or has massive PE, thrombolytic therapy may be considered, following the appropriate protocols and consulting with specialists as needed. Throughout the process, I closely monitor the patient for any signs of complications, such as bleeding or adverse reactions to medications. I also provide continuous assessment of the patient's response to treatment, adjusting as necessary based on clinical progress and laboratory results. Additionally, I keep the patient and their family informed about the condition, the treatment plan, and potential outcomes. Ensuring that they understand the importance of follow-up care and adherence to anticoagulant therapy is crucial for preventing recurrence. In summary, managing a patient with a suspected pulmonary embolism involves swift and accurate assessment, timely diagnostic testing, and a well-coordinated treatment plan to address both the immediate and longer-term needs of the patient.
Describe your experience with managing patients with substance abuse disorders.
Managing patients with substance abuse disorders requires a compassionate, non-judgmental approach combined with a structured and evidence-based strategy. My experience in this area has emphasized the importance of understanding the complexities of addiction, addressing both the physical and psychological aspects of the disorder, and providing holistic care. When a patient with a substance abuse disorder presents, my initial focus is on establishing rapport and creating a trusting environment. Building a therapeutic relationship is crucial, as it encourages the patient to be open about their substance use and any related issues. I conduct a comprehensive assessment that includes evaluating the patient's substance use history, any co-occurring mental health conditions, and the impact of substance abuse on their overall health and functioning. For patients in acute situations, such as those experiencing withdrawal symptoms or overdose, my approach involves addressing the immediate medical needs. This may include monitoring and managing withdrawal symptoms using evidence-based protocols, administering medications to alleviate symptoms, and providing supportive care. In cases of overdose, I follow protocols for the use of antidotes, such as naloxone for opioid overdose, and ensure that the patient receives appropriate emergency care. Treatment plans for substance abuse disorders are often multidisciplinary and may include both pharmacological and non-pharmacological interventions. I collaborate with addiction specialists, counselors, and social workers to develop a comprehensive care plan that addresses the patient's needs. For many patients, medication-assisted treatment (MAT) is a key component, and I am experienced in managing medications such as methadone, buprenorphine, or naltrexone, depending on the substance involved. I also emphasize the importance of behavioral therapies and support systems. I work to connect patients with counseling services, support groups, and community resources that can assist in their recovery journey. Motivational interviewing and cognitive behavioral therapy are examples of approaches that can help patients address the psychological aspects of addiction and develop coping strategies. Continuity of care is vital in managing substance abuse disorders. I ensure that patients have access to follow-up care and ongoing support to maintain their recovery and prevent relapse. This includes coordinating care with primary care providers, mental health professionals, and substance abuse counselors. Throughout the process, I maintain a compassionate and supportive approach, recognizing that substance abuse disorders are chronic conditions that require long-term management and a multifaceted approach. My goal is to support patients in achieving and maintaining recovery, improving their quality of life, and addressing any underlying issues contributing to their substance use.
A patient arrives in the emergency department with a gunshot wound. Outline the steps involved in managing this patient.
When a patient arrives in the emergency department with a gunshot wound, it is crucial to manage their care systematically and efficiently due to the potential for life-threatening injuries. My approach begins with a rapid assessment, focusing on the primary survey to identify and address any immediate threats to life. Upon the patient's arrival, I start by ensuring a rapid but thorough evaluation of their airway, breathing, and circulation. Establishing a patent airway is paramount, especially if the patient is unconscious or has compromised breathing. Supplemental oxygen is provided as needed, and I assess the patient's breathing for any signs of pneumothorax or hemothorax, which may require immediate intervention. Circulatory assessment involves checking vital signs and establishing intravenous access to administer fluids and medications. I closely monitor for signs of shock, which can be common in patients with significant blood loss. Once the immediate life threats are addressed, I perform a focused secondary survey to identify the specifics of the gunshot wound, including the entry and exit points, if applicable, and any potential associated injuries. This involves a detailed physical examination and imaging studies, such as X-rays or CT scans, to evaluate the extent of internal damage and guide further treatment. Pain management is another crucial aspect of care for these patients. I administer appropriate analgesics based on the patient's level of pain and overall condition while carefully considering any contraindications or interactions with other treatments. Coordination with a trauma surgeon or surgical team is essential for patients with significant injuries. If the gunshot wound has caused severe internal damage, such as to vital organs or major blood vessels, the patient may require urgent surgical intervention. I ensure that all necessary preparations for surgery are completed and that the surgical team is fully briefed on the patient's condition and any pertinent details of the injury. Throughout the patient's care, I continuously monitor their vital signs and overall status, being vigilant for any changes or complications that might arise. I also provide clear communication to the patient and their family, explaining the nature of the injuries, the treatment plan, and any expected outcomes. Offering support and addressing their concerns is vital in managing the emotional impact of such traumatic events. After initial stabilization and treatment, I focus on coordinating with follow-up care teams, including rehabilitation services if needed, and providing guidance on wound care and recovery to support the patient's long-term recovery. In summary, managing a patient with a gunshot wound involves a systematic approach to addressing life-threatening conditions, detailed assessment and treatment of the injury, effective pain management, and coordination with surgical and follow-up care teams to ensure comprehensive care and recovery.
What is your experience with managing patients with mental health crises?
Managing patients with mental health crises requires a nuanced and empathetic approach, emphasizing both safety and effective intervention. My experience in this area has equipped me with strategies to handle a variety of mental health emergencies, ranging from acute psychiatric disturbances to severe mood disorders. When a patient presents with a mental health crisis, my first step is to establish a rapport and create a safe, non-threatening environment. This involves active listening and showing empathy, which helps build trust and encourages the patient to communicate openly about their thoughts and feelings. I perform a comprehensive assessment to determine the nature and severity of the crisis, including evaluating the patient's level of distress, potential risk to themselves or others, and any underlying psychiatric conditions. Safety is a top priority in managing mental health crises. I assess the immediate risk of self-harm or harm to others and take necessary precautions to ensure the patient's environment is secure. If there is a significant risk of suicide or violence, I may need to involve security personnel or arrange for psychiatric evaluation in a secure setting. In cases where medication is necessary, I work closely with psychiatrists or other mental health professionals to ensure appropriate pharmacological treatment is administered. This might involve prescribing or adjusting medications to stabilize the patient's mood or address acute symptoms, always considering the patient's medical history and current condition. Crisis intervention often includes therapeutic techniques such as de-escalation strategies, cognitive behavioral approaches, and supportive counseling. I use these techniques to help the patient regain control and work through their immediate distress. For patients with severe psychiatric symptoms, such as hallucinations or delusions, I ensure that the care plan addresses these symptoms effectively while maintaining a focus on safety and patient-centered care. Coordination with mental health specialists is crucial. I collaborate with psychiatrists, psychologists, and social workers to develop a comprehensive treatment plan that addresses both the immediate crisis and long-term needs. This may include arranging for inpatient care, outpatient follow-up, and connecting the patient with community resources and support services. Family involvement and support are also important. I keep the patient's family informed about the situation and involve them in the care plan when appropriate, providing them with guidance on how to support their loved one and manage their own stress. Throughout the process, I maintain a focus on compassionate care and respect for the patient's dignity and autonomy. Mental health crises are often complex and require a balanced approach that addresses immediate safety concerns while laying the groundwork for long-term support and recovery. My goal is to provide holistic care that stabilizes the patient in the crisis moment and supports their ongoing mental health needs.